Hey everyone, David Wright here, host of the Disruptive Innovators podcast, coming to you live from CCW in Las Vegas, where we've been talking to some of the sharpest minds in customer experience. This stretch of content is brought to you by Sonus, the real-time speech AI platform that's tearing down communication barriers, cutting through noise, and closing language gaps so that every conversation comes through exactly the way it was meant to be heard. They're doing genuinely cool work in the space, so do yourself a favor and pay attention. And Authentics, the conversation intelligence platform built specifically for healthcare, taking millions of patient and customer interactions and turning them into insights that actually move the needle on experience and operations. If you care about understanding what your patients are really telling you, these are the folks to watch, and we hope you enjoy the content. Good afternoon, friends. David Wright here, and I'm your host of the Disruptive Innovators Champions of Digital Business podcast, coming to you live from Las Vegas, Nevada, here for the CCW conference. And my first guest of the entire event, Antrea Dowd. Pleasure to have you.
Thank you for having me.
I'm excited to discuss a number of things with you. Before I do, I just want to shout out our sponsors for the event. Sonus is the real-time speech AI platform that removes communication barriers, eliminates noise, and closes language gaps, ensuring every global conversation is heard exactly the way it was meant to be. And Authentics, which is an AI-powered conversation intelligence platform purpose-built for healthcare, turning millions of patient and customer interactions into actionable insights that improve experiences and operations. So in case you were curious about that. So appreciate you being here. Andre, I know we had to navigate the catacombs of Las Vegas to get here.
Yes, yes.
And I love your shoes, by the way.
Thank you.
For any of our listeners who may not be familiar, just to start, would you mind sharing a little bit about your current role and organization?
So I have a unique role with HCA. It is at the crossroad of workforce development, operations, patient-centered, and really just kind of turning students into employees and then upskilling our current employees into different roles to fill the gap. So we're kind of doing a little bit of everything in this role. My day consists of dealing with students. I deal with campus presidents and program directors as well as facility leaders and then students themselves. And the ultimate goal is to fill our own gap, right? There is this huge workforce gap in healthcare, mainly around CT, surge tech, a lot of the ancillary services.
Sure.
And so now we're sitting back trying to figure out how do we close that gap? How do we use what we have and go ahead and close that gap? And that's where I come in.
Love that.
I'm a bit of
And
a fixer.
what does customer experience mean to you in the role that you serve for the organization?
That's a good question. So I have a coordinator who works with me, and when I speak with her, I tell her we have several customers,
Mm,
and she always kind of looks at me a little crazy. And the reason why I say that is because we have internal customers, which are our facilities, right?
right.
The C suites of the different facilities, and then we have our external customers, which are the schools, the campus presidents, and the program directors. And then there's the students because they're customers until they flip over into employees.
Sure.
And so each area requires a different touch and a different knowledge base and a
Yeah.
different kind of approach and attitude. And so you have to be very short, sweet cliff notes when you're speaking with the C-suite
C-suite.
people,
Hmm.
very explanatory when you're speaking with the students. And so it's really just trying to help her understand that everyone is a customer
Right.
and treat them accordingly.
Now that makes sense, though. As I always would say, as an IT and digital steward, working with a health system, that we refer to customer experience because when we're referring to the customer, we're referring to both the patients as well as, the folks that we're serving internally. So, anyone who's using and leveraging digital tools to communicate with the patient. So that tracks. So, so what brought you to CCW this year? Have you been here before? And, either way, what were you looking to get out of the experience?
So I have an interesting relationship with CCW. So I actually spoke at their conference in Austin.
Mm,
So I have a podcast and it's Purpose, Presence, People. We do leadership development.
love that.
And so there was a conversation had with all of this technology that these organizations are picking up. How do we get our teams to actually execute what we're purchasing and
Mm,
make it work?
yeah.
And so I came out to their Austin conference and spoke with them and taught them coaching from the edge, is what I call it. And then they called me back and said, "Hey, we have a bigger conference in Vegas. Will you come out and will you do that one and give us the foundation of where leading from the edge comes from?" So I'm here to kind of help them transition from product to execution.
Lisa Griffin, she is the chief consumer officer at University Hospitals in Ohio. She talks or has talked to me about like the art of storytelling
Mhm.
and, a bunch of other leaders that I really admire focus on this body of work. And I just think it's, as I've grown in technology, I've just seen how important it is, the cultural element of it, the
Mhm.
organizational change management element of it, to the tune that I think my consulting organization, I would say we focus more on that nowadays
Mhm.
because the success and failure of the initiative more often than not hinges on the work that you're doing
Mhm.
and like the topics that you're talking about.
Mhm.
So it makes sense. Would you say that that is something that, I mean, you probably would, CX leaders are missing, or if there was one piece of advice you'd have that you think uh, CX leaders are missing, or an area where they're missing the mark, like maybe you can even just expand on your coaching that you're doing. Like, what would you share with the listeners?
I think most importantly is understanding that AI is not here to replace.
Mm,
Right. I think in order for AI to be successful in my mindset, especially in healthcare, is it's here to work with us
yeah.
and not against us and to make your job easier. The one thing that I found is clinicians, they're very smart at we can save lives, right? That's what we do.
Hmm.
But you put a computer in front of us and we're like, well,
Hmm.
I don't want to do this, and it makes my job a little more difficult. And so when that fear happens or that misunderstanding that my job is a little bit different and it's because of this computer, I don't want to touch it and I don't want it in my world.
Mm,
And so really communicating how it's going to make your job easier.
right.
I think one of the best things that have come down that I've seen is when it comes to patient experience, moving the patient through the journey a little bit quicker simply by getting the MRI read a little bit quicker,
Yeah.
right? How does that happen? Well, there is a software. I'm not going to be an expert on it, but I just know that it helps the radiologist read those images a little bit quicker.
Right.
Right. And so it's not replacing him, it's
Right.
just helping him. And I think that's the disconnect, at least in healthcare,
Mm,
is that they feel like it's a replacement and not helping.
yeah. It's interesting. There's in the last few days, there's been an article that's been floating around the CX world about IKEA. They rolled out some AI agents, and they were able to basically shift. It was like thousands of workers, as opposed to laying them off. They rededicated them to like basically being like, it sounded like personal design assistants
Mhm.
for customers as they were,
Yeah.
traversing the IKEA, you know, um, sales motion, and they created like $1 billion in sales. Don't quote me on the number, but it was like they used that opportunity to drive revenue. And I think when you first kind of introduced some of the work that you were doing, I think it's a tremendous opportunity, not only from a sense of like, hey, in healthcare, we have shortages of people to do the work fundamentally, right? So, like,
Yes.
I think that's like, when we talk about AI, like people are concerned about losing their jobs. It's like, well, like we don't even have enough nurses and doctors
Right.
to do the job.
Mhm.
So, and it's an understandable fear.
Mhm.
And at the same time, I think what you're doing in educating people on like the upskilling, I think it's relevant in healthcare and outside of healthcare. Really, it's relevant to all industries. Yeah.
Yeah. You
Oh,
gotta catch up.
right. So closer to home, Is there an initiative or project that's taking up most of your headspace as you head into the second half of this year or early next year? Or what are you most excited about? Any initiatives specifically that you guys have, coming up that you can share with us?
Like I said, part of my role is fill in the gap.
Right.
And so I create and roll out programs and work with different schools to kind of combine that. And it's just to take their campus program and put it on our campus, right, on our hospital campus and upskill our people. I think for me, what would be wonderful if we were to tie AI into it, we just opened up or not open up, started a platform that helps with student placement. So
Mm,
before it was very manual. If you wanted to place your student on a rotation, you picked up the phone and called me
right.
and my coordinator on the computer. Right. And so now you go into a system and you click and it's done. But then there's still a manual component to it. It would be wonderful if that was completely automated and we could shift our gears to really rolling out these programs because it takes time to build curriculum and things like that.
Love that. Um, so this has been amazing. Andrea, I like to close my podcasts with questions like this. So I actually have two questions. One would be, if you could go back 5, 10, or 15 years in time, what advice would you give your younger self?
Buy stock in Blockbuster and tell them to buy Netflix.
That's good advice. I guess now my final question would be, if there were one piece of actionable advice you might look to leave the listeners with, what might that be?
Embrace it.
Mm,
It's coming. Don't fight it, right? Let your organization be the phoenix and not the dinosaur. We don't want to sit back and let the world pass you by as you get left behind with this technology drive. Just embrace it. You can't stop it.
yeah. And if you need coaching on, what professional development or organizational change management strategies look like,
Mhm.
this is your woman right here. Thank you so much for taking the time today, Andrea. I really appreciate it. And if you want to learn more, you can go to purposepresencepeoplepodcast.com to learn more about.
Leading from the edge.
There we go. Good afternoon, friends. David Wright, and I am your host of the Disruptive Innovators Champions of Digital Business podcast, coming to you live from Las Vegas, Nevada for CCW. And I am lucky enough to be joined by our friend Shmuel. Shmuel, it's a pleasure to have you here.
Yeah, thank you. It was really a pleasure was able to join you.
Yeah, absolutely. So, Shmuel, before we get into everything, I just want to quickly shout out our sponsors. Sonus is the real-time speech AI platform that removes communication barriers, eliminates noise, and closes language gaps, ensuring every global conversation is heard exactly the way it was meant to be. And Authentics, or Authentic CX, is an AI-powered conversation intelligence platform purpose-built for healthcare, turning millions of patient and customer interactions into actionable insights that improve experiences and operations. So, in case you were curious. Um, so, Shmuel, to start out, would you mind introducing yourself to our listeners and just talking a little bit about your current role and organization?
Yeah, absolutely. Yeah, thank you again. So my name is Shmuel Saklad. I am the senior manager, the enterprise accounts department at B&H. So B&H is definitely more well known as a retail store, kid in the candy shop. If you've ever been there, the buckets going across across the top.
It's true.
Super fun. But we are also big in the B2B space. So whereas, you as a consumer are buying for yourself, we are working with corporations, we're working with local governments, K-12, higher education. And it's really, they're purchasing anything from a book or paper, I don't know, books, paper, all the way up to high-end broadcast equipment, and really everything in between, anything photo, video, or audio related. So we're an inbound, my department's an inbound contact center, and we're really, just serving the customer. That's what we're here for. I started as an agent on the phones literally just had my 12 years yesterday.
Wow.
Yeah, so which is pretty crazy. Never thought I'd be in a contact center career.
It's like most of us.
Yeah, I know. It's funny how that works. Um, but yeah, I came to B&H. I needed a job, used my network, got in, and here I am 12 years later, and I worked my way up, understanding what the work is and how it needs to happen, supporting customers, but also now I'm supporting my people to support the customers.
Right.
So I have 4 teams that work with me, and they are managed by a manager, but then obviously made up of the employees, the associates. And my job is to help my team be the best that they can and really help give customers the best experience possible every single day.
Love that. Yeah, B&H, New York City staple, you know. Did they I feel like they used to sponsor the Yankees games too, like,
I
I
don't
mean,
know.
I don't know. I mean, everybody, if you're from New York, you know B&H, and I mean, I know they're much more prominent,
But yeah, but it's
nationwide,
true. It's true.
but
You know the corner, they're there. Yeah, you go in and it's like, whoa, you don't even know what's happening.
it's true.
Still love it.
And their prices always rival, like, the big guys, which I appreciate,
Yeah.
because I'd rather buy from, you know, someone who's grew up in my community. Anyway, so we're here in Vegas for CCW. What brought you out here? Have you been to the conference before? What were you looking to, get out of your time here?
Yeah, so actually my first time here,
Nice.
first time in Vegas actually, which is
Oh,
pretty crazy for
yeah.
me. Yeah, I'm actually speaking on a panel tomorrow.
Nice.
So we're talking about interviewing and why our hiring models are broken and how do we fix it and how do we
Huh?
get better. And so that's really what brought me to CCW. I mean, I've always heard about it obviously and always wanted to make it out, but this is obviously a great opportunity to do that. And I'm here to have conversations with people, learn what we're all dealing with. I think what sometimes we think everyone else has it together, and we think everyone else is perfect and knows exactly what to do, and then you lift the curtain a little bit and you're
Yeah,
like, we're all figuring it out,
it's
you know?
true.
So that's always a great thing, just to connect with peers, hear what they've done and what's working for them,
Hmm.
and how do I take that, apply it to my business, and help myself.
Yeah, it's a great point. My experience has been that usually there's a given use case or a given area or a given piece of the puzzle that someone might be excelling in, and for those reasons it's a great but to your point, a lot of the other areas maybe not so much, right? And then so if I'm on stage talking and presenting, maybe I'm presenting on that bit and not so
Right.
much the other bits. But what it is, it's an opportunity for me to take, from one of those areas that one organization is doing well, learn from that, share what I'm doing well. But it's true. I mean, especially when now we're looking at the age of AI and what's possible, and the innovation curve that we've seen even the last
Huge,
like couple of years.
huge.
um my organization, as CX and contact center AI experts, my other organization, we haven't seen many people that are just like so far and away ahead of the
Yeah,
curve in all
yeah.
the areas. So it's true. We're all kind of trudging the path here. Here's one thing I do love of asking. What's the one thing you think every CX leader should be paying attention to right now that just isn't getting enough airtime?
Yeah. So I'll actually do 2 things. One is I think there's like you just brought up about AI, right? And I think there's obviously a major focus on what AI is doing and how it's changing the work and what it's removing from our associates and our agents. But I think we tend to focus on that and we are missing. I think there's just some now conversation about what about the leaders managing those agents? How are they adapting? What are you doing as directors, VPs? How are you supporting your frontline staff to now manage a different workforce
Mm,
and people dealing with different challenges, people who are now figuring out the tech, figuring out, okay, now I may have to manage human agents and AI agents. And that role is changing too. And
yeah,
we're not talking about it.
right.
So that's, I'll say, the one big thing. And along with that, I would say, it's important to speak the language that matters. And sometimes as practitioners, we can get stuck in, the metrics and talk about AHT and right and CSAT but what does that mean?
Yeah.
Right? What does that mean to an executive? And we have to think about what room we're in and how that language needs to change to actually accomplish what I want to accomplish.
That's a great point. I've heard that said before, but it's such a great reminder of like, who am I presenting to? How am I translating what I know into, a language that that audience can
Yeah,
appreciate?
and it's hard, I think, when we're so involved in the work,
Yeah.
right? Like we're so used to. What do you mean? How do you not know what this
CSAT,
means?
acronym,
What that?
acronym, acronym.
Yeah,
Yeah.
right. But CSAT means what was the loss, right? What opportunity or business am I losing by not having increase of CSAT? Okay, we were able to hit these many customers, but what about the 10% that you didn't get? Right.
Right.
So thinking about it in terms of business outcomes, revenue, costs, right? And it's the same data, it's the same information. It's just, you gotta, someone told me actually a really good metaphor lately. When go to a museum and you look at a statue, right? You're staring at it from your perspective. But if you go and you're standing over there, you have a different perspective.
Sure.
So you have to think about it from all angles and all areas. And if you're getting stuck, okay, well, let me shift. Let me think about move my space and see how I can change.
It's true. And it's, building on that metaphor, right? Because I love that. Um, you know, subset of people might go to the museum and they're all standing at different angles and they're looking at the art and they're tilting their head this way. And then the museum curator comes
Mm-hmm.
by and they say, well, the meaning of this painting or this piece of art is, the artist was suffering from a breakup and
Mm-hmm.
they depicted this was what their insides felt like. And they're like, oh, okay, right? And then the last person who misses the whole group goes there and they're just looking at that and they're like, what the hell is this? And it's like the and I've said this before on the podcast, but like the success of the initiative is in the perception of
Mm.
the person who's using it or
Yeah.
who's at the organization or what have you,
Yeah.
right? So
Like context matters.
exactly, exactly, and understanding
Yeah.
matters. And one thing I didn't want to forget that you mentioned before was and one of the things that I heard was, you know, as a director or leader, um, we have this AI workforce, we have our
Mm.
own workforce, and actually somebody mentioned it the other day on the podcast, like, we have these solutions spinning up and they're serving our customers. How what should the AI sound like?
Mm.
What should it, and for different geographies and different
Mm.
groups of people and there's a lot there to like human centered
Yeah.
design
Yeah.
that isn't just like rolling out the
What
technology,
do you mean? You just plug it in and turn it on, right?
right?
No, you're talking about right, different cultures, different, ways of communication. Someone was telling me last night that there was one culture would rather have a 8-minute conversation and one culture would rather have three 2-minute conversations, right? So that math didn't work. But let's say it was whatever, you know what I'm saying?
I get what you're saying,
So the overall time might be the same, but it's different.
right? Well, and I had a conversation with someone last night myself, right? And we were talking about how some people in certain geographies, and this can be within a state,
Mm.
right? So it's not just like state by state. It could be like, so we're talking about Georgia, you have Atlanta, and then you
Yeah.
have like the
Rural, yeah.
boondocks, right? Where some people are more apt to pick up branded 800 numbers, whereas other people are more likely to pick up local
Mhm.
ANIs, right? And so it just goes to show too, like use case by use case, community by community, like I have to be really thoughtful about how I'm designing these solutions.
Yeah, and to jump on that, even in the same city, talk about age demographics,
Mhm.
right?
Right.
A younger person is probably less likely to pick up a phone call than an elderly person, right? So even in the same area, right? There's so much you have to think about, and it needs a real design. It's not just let's just do it.
Right.
And there's a lot that gets lost along the way.
Agreed. So, Shmuel, and this is like a little closer to home, what's one initiative that is, you know, or project that's taking up the majority of your headspace, either for the latter part of this year, early next year, kind of what's on the roadmap for you here in the next number of months?
Yeah. So one thing we're really, really focused on is kind of this topic of what can we use AI for? Right? What are we doing that's doesn't really need that human element to it?
Mm-hmm.
A little bit more of like data process entry, like manual work that I can have somebody, a human, who's empathetic and has judgment. I'd rather them have a conversation with a customer on the phone,
Right.
right, than sit there entering info on a keyboard,
Yes.
right? So that's something we're really looking at. How can we automate? Not necessarily AI, right? Because there's a lot of
Automation,
automation,
AI,
AI.
right?
These are very different,
Mm-hmm.
different terms. But what can we do to automate that process, to free up our people to do things that they should be doing?
Right.
So that's probably the biggest one.
Yeah.
Second is I think there's a lot of conversation about, we get feedback from surveys. We get, that's a portion of the conversations that you have. But there's also obviously your phone calls and your emails that you already have. And what are we doing with that data?
Mm,
How are we, analyzing it, synthesizing it, understanding it for sentiment and pain points? And again, similar, what technology, what function, or what are we going to do to be able to understand what our customers' frustrations are, what their pain points are,
mm,
and just removing those to give them better experience. I think expectations are rising, right?
yeah,
Customers expect more,
it's true.
and we have to adapt and we have to grow with it.
This is true. Um, so Shmuel, this has been great. I have two last
Mhm.
questions that I want to run by you. Um, First would be, and I like to just ask a lot of my podcast guests this: if you could go back 5, 10, even 15 years in time, I mean, you're a fairly young guy, but
Yeah.
what advice would you give your younger self?
Yeah. Be confident in who you are.
Mm, that's a great one.
I think imposter syndrome can really get to a lot of us.
It got to me.
Yeah. And you deserve to be in the room, and
Yeah.
you know what you're doing, and just be confident.
Yeah, I love that. And I think that the more that I can, as a young leader, young executive, um, have the conversations with the guys and gals that have gone before me,
Mhm.
I don't think I did it as good enough, or I think I could have done a better job reaching out.
Mm.
And if I had heard that this guy that I really admire also struggled with imposter syndrome or fear of failure or whatever it would be, I think that everything happens for a reason. And
Sure.
I think I'm
Yeah.
exactly where I'm supposed to be.
Yeah.
So it's kind of a loaded question, but
Yeah. But I agree. I agree with you. Yeah.
yeah. And then the last question would be just one piece of actionable advice you might look to leave everyone with today, relevant to CCW or otherwise.
Yeah. I would say, and something I tell a lot of my team members: continue being curious.
Mm,
I think when we stop being curious, you stop growing. If you're not growing, what are you doing?
amen. It's a great, great piece to end on. So thank you again,
Yeah.
Shmuel.
Thank
This
you.
was great. And to our listeners, keep tuning in. And thank you very much. Good afternoon, friends. David Wright here, and I'm your host of the Disruptive Innovators Champions of Digital Business podcast, coming to you live from Las Vegas, Nevada for CCW. And I'm honored here to be joined by my friend Dale Sturgill from Memorial Hermann. Dale, it's a pleasure to have you.
Thanks for having me.
Yeah,
Appreciate it.
yeah, I'm excited that we got to catch up here. It was kind of random, but happy accident here.
Always good. Absolutely.
Um, Before we get into anything, I just want to shout out our sponsors, Sonus, real-time speech AI platform that removes communication barriers, eliminates noise, and closes language gaps, ensuring that every global conversation is heard exactly the way it was meant to be. And Authentics, which is an AI-powered conversation intelligence platform purpose-built for healthcare. turning millions of patient and customer interactions into actionable insights that improve experiences and operations. So, Dale, obviously you're here, or maybe not obviously, but you're here speaking at CCW. But for those of our listeners who may not be familiar, just tell us a little bit about yourself and maybe your role at Memorial Hermann.
Absolutely. So I've been in contact centers pretty much my entire life for about 30 years. I live by the 4 Fs. It's faith, family, football, and phones.
Amen.
So that's kind of where my journey has taken me. At CCW speaking, but also it's always good to see best practices, hear from other leaders. But currently, as the vice president of strategy for contact centers at Memorial Hermann, based in Houston, Texas, we're in a bit of a transition right now. We're looking at digital. We're looking at AI innovations. We're looking at things that make our patient experience better, our consumer experience better. So that's always at the foundation of why we're here and why we're doing other things as well in this space.
100%. Yeah, and then that's actually a good transition to kind of my second question for you, which would be, you know, if there was one thing you were looking to take away from CCW this year, or something you were looking to get out of the conference, what might that be?
Best practices. It's always about best practices, especially with AI and the big push for AI. And I think a lot of companies are really looking at how can AI help with the patient experience and consumer experience in healthcare, the customer experience across all platforms. So for me, talking with other leaders about their best practices, what have they seen? What are the roadblocks that they've hit, the speed bumps that they've hit? How did they overcome that? So that we can take that back with us and create some best practices off of that.
Yeah. No, it's a great point. One thing that we've seen with the advent of agentic AI, particularly for conversational AI on the
Hmm.
front end of, and in our case, a lot of healthcare customers, is we've seen some folks roll out agentic conversational AI for smart routing,
Hmm.
right? Which can be kind of dangerous, right? Because, with the tokenization of everything,
Hmm.
costs can inflate really
Hmm.
quick. So, am I working with a vendor where I can use maybe a more classic natural language understanding model for just some of the basically intent-based routing on the front end of the
Hmm.
conversation, and then use some of the conversational AI and agentic models for some of the downstream use cases where I actually want that more conversational experience. um so it's just an example of you know something that we've picked up recently, that if I'm not in the conversation with experts like yourself and these colleagues in the industry, I could be missing the mark you know
Absolutely.
um, so, Dale, here's one thing I love asking. What's one thing you think every CX leader should be paying attention to right now that just isn't getting enough airtime?
It's a fantastic question. I think it is the adoption of technology with our older customers. Surprisingly enough, as we've implemented new technology, new automation, new self service, 55 and older has been the really sweet spot of those that have really taken to it and adopted the use of that technology. So
Hmm,
I think looking at it, and again, you don't want to look at age and things like that, but it's very important to understand your
I
audience, to
think it
understand
is.
your customers. And I think that is really what shocked us the most is just people my parents age that are really adopting and really taking hold of technology and using it for to be for convenience and for self-service and things like that. So it's really amazing. I think that's where a lot of leaders in the space really need to focus is where's the push at. And I
Yeah,
think it's really in that bracket.
and it's great to hear, because I think a lot of leaders might assume that age
Hmm.
bracket is going to be hard to uh, cater to
Hmm.
because of their age.
Right.
They're opposed to AI.
Right.
I agree with you that there's three things that I like to say. We've seen even the most Luddite consumers lean into AI. If I can make it personalized,
Hmm.
radically convenient, and compassionate, ideally, and if I can manage the expectations. So sometimes, I might even start a prompt by saying, like, "Hey, this is an AI. Like, um, I imagine you might want to speak to a uh, an agent, but I might be able to solve your problem and get you off the line quicker.
Mhm.
Like you could almost make it that conversational
Right.
and kind of jovial.
Right.
And they say, okay, fine. And it's like, so is this Mary calling? Like, are you calling about your prescription refill? Like I see you're on,
Mhm.
so-and-so.
Right.
Well, yes, actually. Okay, great. I can just refill that right now.
Well, and the systems are becoming so smart to be proactive, like you said. I'm calling to pay a bill, but hey, did you also know that you have this? Or hey, are you aware that you need to schedule this appointment? So the ability for the AI to be proactive and offer that help, and then allowing the customer to make the decision. Do I want to speak to a live person? Do I feel confident in the automation? And so really it's about building that comfort for sure. I agree with you.
Right. Love that. So closer to home, um, what are some of the, without getting too specific, maybe some of the initiatives or some of the projects that you guys were looking to latter part of this year, early next year, just, high level? What are some of the things you're looking at?
Yeah, so we recently transitioned in a new CIO.
Ah,
That is public knowledge. So she's looking at more innovative ways that we can leverage AI, leverage systems, looking at our technology. She's really doing a deep dive into that. So I don't have any specific initiatives that are at the top of the list, only because we want to prioritize. We want to take advantage of the resources that we have. Naturally, the budget that we have to look at the things that are most impactful. How can we leverage AI? How can we leverage better technology in our contact centers? How can we leverage better technology in our hospitals? How can we leverage better technology in the pharmacy? All of those things are being looked at. So I would say at a very high level, if I had to put a ceiling on it, is we're looking at all the ways that we can leverage new technology for the betterment of our patients, the betterment of our employees, because we have a large employee base that also utilizes our contact centers. So
of
how can we
course.
leverage technology and then create the initiatives from there? And there are so many. I could sit here and talk to you for 3 days on all the initiatives that we have, but I think primarily it is looking across what technology is available, how it best fit our patients and our callers, and that's really the initiatives that we're focused on.
Yeah, and that's one of the things that I always appreciated about you, Dale, too, is I think from some of your background in CX and contact center outside of healthcare, emphasis on workforce,
Mhm.
kind of how are you serving not only the external patient as a
Mhm.
customer, but your internal
Mhm.
customers. And I hear that in what you talk about, and I really appreciate that. Um, so two last questions I have for you, Dale, that I always like to ask my podcast guests. One would be, um, if you could go back 5, 10, 15 years in time, what advice would you give your younger self?
Wow, great question. I think honestly, it would be to dive deeper into the technology. I think that AI has really brought out, at least for me, the fact that I was a creature of habit. I knew what I
Mm,
knew, and I trusted what I knew. And so I think that breaking that cycle of really just looking at what I knew worked, and be willing to take a risk, be willing to look at other technology, not necessarily the status quo that I was used to. So I think that would be one thing. Be open to new opportunities. I mean, AI is coming on board and it's really moving fast. And so I wish I would have looked into that sooner. So that's the first thing. I think the second, if again going back and understanding is, wouldn't it have been great to know back then where we would be today, and to really market that and leverage that and really be on the forefront of that as a consultant, as a person. I don't want to say that I'm an expert, but certainly use the experience that I've had to help be further along when you're talking about large language models, you're talking about innovation and automation. Just really being on the forefront of that would have been just a spectacular thing to tell myself 5 years ago.
right. And invest more in NVIDIA.
Absolutely. Well, I mean, in automation through voice, outbound, inbound,
Right.
the natural language voice. I mean, we had mentioned before about the age bracket. It's amazing the amount of call recordings that we listen to where someone thinks that they're talking to a live person
Yeah.
just because of the innovation in the voice and the fact that you can select multiple voices. I mean, we're blessed where we are at Memorial Hermann that we're moving towards we have someone that just has a spectacular English and Spanish voice. So, leveraging her from a voice, but also utilizing AI to expand that out is just going to be spectacular. So all those things that bring that comfort to the caller and the innovation that's there is just it's amazing.
I think that's also actually just another important thing that you mentioned in regard to the vendors that I'm working with in my
Hmm.
ecosystem. If I don't like the way a voice sounds,
Hmm.
right? Don't let that be the impetus for not working with that vendor if I like everything else, right? Like I can go to 11 Labs, I can go to Google, I can go to. So the point is that like ask the questions
Hmm.
about like is this the only voice that we have access to? Like, because I feel like sometimes like that won't get brought up by the vendor,
Right.
and maybe the folks won't ask, and then they're just like, that voice sucks behind the scenes, and
Right.
then they end up counting that vendor out
Right.
when you could use literally thousands of voices.
And I will say this: if I don't make a selection, or if we don't make a selection based on the voice that is coming, we did not do our due diligence anyway. So shame on us, because that shouldn't be the deciding factor
I agree.
in partnering with a vendor.
Yeah.
But but there are others out there that are absolutely, if that came down to the tiebreaker, they might use that as the tiebreaker. But I absolutely agree.
No, this is great stuff, Dale. Last question would just be if you had one piece of actionable advice you might look to leave our listeners and or the CX community with, what might that be?
Adopt as much learning and knowledge of AI as you can, because it's exploding and it's expanding, and just really getting in and understanding how it can help you, how it can help your consumer, how it can help your employees. I think all of those pieces of the spectrum are important, but really just dive in and understand the difference. I really like what you had said about the two platforms, if you will, having a very simplistic front end, and then more of after the intent, more of the deep dive into the actual process behind the intent. So just diving in and understanding that, and additional things within AI is where the world's going for sure.
Huge. No, Dale, this was great. Thank you so much for taking the
Absolutely.
time.
Thanks for having me.
Yeah. And to our listeners, thank you for tuning in. And we'll catch you on the next bit.